The skirt is actually made of pieces of fabric that I've cut. It contributes to the motion of what's happening in the painting as a whole. My main concern was to try to make the fabric feel as though it was moving. I've always been an artist. I've never not been an artist. I'm currently a mixed media painter after having been a creative director and art director in educational publishing for most of my life. I worked from the time I was 13 and I was always very self-sufficient financially. In 2008, the crash came. I lost my savings at my house and moved from upstate New York in Rhinebeck to the Bronx with virtually no savings and a very, very fixed income based on Social Security. I needed to figure out any and every way that I could possibly save money legitimately. So I didn't have to rob any banks. I was applying for SNAP benefits. I was just doing everything I could. I occasionally dog sit. I needed to find help. Recently, I heard about the Medicare Rights Center through a social worker, and she said, they're going to help you. You don't have to worry.
Medicare Rights Center, Gianni speaking.
These days, when you make a phone call, you expect 26,000 mechanical messages before you even have the hopes of maybe speaking to a real person. The experience with Medicare Rights Center was completely perfect for me.
Ms. Friedman came to us to get assistance on applying for the Medicare Savings Program to help pay her Medicare costs like the Medicare Part B premium.
They helped me fill out the application with all the necessary backup to show that I was in fact needing this help, and then offered to fax my application to the Human Resources Administration. Lo and behold, after a month, I heard nothing. After 2 months, I heard nothing. After 3 months, I heard nothing.
We helped her apply back in October of 2023. Unfortunately, due to some delays at the Human Resources Administration, that application wasn't processed until February of 2024. And unfortunately, when it was processed, there was a mistake that they did on their end. Therefore, they deferred her application and they sent her a notice saying that we got your application, but some documentation is missing.
You're laying in bed and you wake up at 4 a.m. and you're trying to figure out if you can make all the bills that month. You can't stop thinking about anything else. I've had so many of those wake-up mornings, really. Everything feels urgent. It just feels awful because you feel alone. I called the Medicare Rights Center again, and they said, let's us track it.
We indicated to them that the application that we had originally submitted did indeed include the missing documentation that they were requesting. So once we brought that to their attention, it was really easily reevaluated and reprocessed.
2 weeks later, when I got the letter, I thought it was a refusal letter. I think I was geared to expect the worst. And there it was. Yes, you qualify for these benefits. We had done it. It was amazing. At first, I didn't really believe it.
Not only are they getting the assistance with their Part B premiums, but through the Medicare Savings Program, they automatically qualify for extra help, which dramatically lowers their prescription drug copays.
That was a surprise to me. And I had to call Gianni and tell him that I just went to CVS and they charged me like $4.50 for something that had previously cost between $35 and $50. And he said, yeah, that sounds right. And I was flabbergasted. It was like birthday, Christmas, you're a good person, Jeannie, all in one batch. It was incredible.
Since it was submitted back in October of 2023, it was made retroactive back to that month.
I got a refund for all the overpayment I made while my application was being processed. I was completely and totally just grateful that there is such a program and that there is such an organization, and it's real people helping other people who have a real need.
On average, one person on the Medicare Savings Program saves about $8,000 annually. That's now $8,000 that they could use to meet rent, groceries, utilities, or just to live a more dignified life that they deserve.
I don't know how I would have continued to survive as decently as I'm doing. I'm not rolling in dough, but it affords me being able to stay in this space and gives me peace of mind to continue my work as a painter. With all my heart, thank you, Medicare Rights Center.